My name is Courtney McHugh, and I'm a licensed social worker and lead navigator at Family Reach. I just want to take a moment to thank Grit Health for the invitation to speak about Family Reach and our services, including all the resources that we provide, as well as thanking all the audience. It's truly a pleasure to join all of you today, as well as each one of the panelists who joined me here today. So I do want to start off with something different, a story. In your mind, imagine a family of four. They are getting by in their apartment and are essentially living paycheck to paycheck. The parents struggle financially and they do everything they can to keep a roof over the heads of their children. Then one day, they receive devastating news. Their youngest child has cancer. Their son is 6 years old and has just started kindergarten. This is a scenario that plays out every day, and it's a story that Family Reach has become very familiar with. I can even tell you what happens next. Their son starts missing his first year of school. The parents focus on the treatment, the appointments, and drop everything and do anything to help their child. They start missing a substantial amount of work. They are motivated by the fear that can only come when a parent is told their child has cancer. But that's not all. Within a month, they are hit with a second wave of fear, one rooted in the financial reality that they may lose their home because of the piling bills. In a nutshell, this is the problem that Family Reach has seen play out for 25 years, and the reason every employee is motivated to help that family. When a loved one is diagnosed with cancer, so often finances really are just not top of mind. Families are grasping the fact that they've been hit with the words cancer diagnosis or you have cancer. And so that's where Family Reach comes in. We come in to provide financial support services to families facing cancer. And we try to remove those financial barriers standing between a cancer patient and their treatment so that a family doesn't have to choose between their health and their home. And how do we do this? We actually deliver what's called the Financial Treatment Program. Our Financial Treatment Program is comprised of 4 key areas: financial education, resource navigation, financial coaching, and emergency relief. Today, I will be highlighting of the 4 key areas our financial education piece with a focus on our financial guidebook. The financial guidebook is used as a resource tool for families and caregivers to start having those conversations in unison with their healthcare professionals surrounding their finances. It's certainly not an easy conversation to be had, but it's definitely important. Inside our financial guidebooks, you'll be able to learn about cost-saving options, easy action steps to follow, checklists for estimating personal costs, advice from patients and other caregivers, as well as a list of other vetted financial resources. Currently, our guidebooks are available in 3 different versions. There's a pediatric cancer guidebook, which is for those under the age of 18. There's our young adult cancer guidebook for those ages 19 to 39. And then our adult cancer guidebook, which is for those over the age of 40. While the foundational information is the same in all copies, there were certain pieces of information that we felt were relevant to separate out and include in those specific populations. Additionally, I will say, as we're trying to reach more diverse populations and groups of people, we currently have our financial guidebooks in both English and in Spanish, and hope to expand this to other languages as well. Our financial guidebooks are downloadable from our website at familyreach.org under the green Get Help tab. Additionally, if a family or a healthcare professional submits a financial treatment program application on our website, if an email is provided, the family will receive an age-appropriate guidebook that will automatically be sent to them. The next few slides that I will be covering just talks about a little snapshot of what's in our guidebook. And here is the first page of what you'll see in our guidebook. And we wanted to really highlight all of what a family can feel, like I had mentioned earlier, when they hear those words, you have a cancer diagnosis. And one of our members during one of the focus groups that we held here at Family Reach had mentioned that at the time her loved one was diagnosed with cancer, she had wished that these words were said to her. And so it reads, "We know, overwhelmed, confused, sad, angry, whatever you're feeling right now, it's valid. We understand that you might not have the energy for more information right now. All we ask is that you take this guidebook home. When you're ready, it will help you manage your money to prepare for what's ahead. It doesn't have to be today, doesn't have to be tomorrow, or even this week. You don't have to get through it all at once. You don't have to carry any blame or shame. None of this is your fault. Just know that this guidebook is here to help." Further inside our guidebook, you'll see this resource key, which is broken down into 3 different topics, and it's associated with colors and icons, hopefully to make things a bit easy on you. Each indicate a specific type of financial resource to help a family pinpoint the most useful information at that current time based upon their biggest concerns and financial needs. Additionally, inside, you can find a checklist of expenses for, let's say, those who have health insurance, and a breakdown of being able to estimate monthly premiums, their out-of-pocket maximum, and kind of get a big picture overview of expected costs. Certainly don't have to have those exact numbers, because I'm sure families are trying to take in all the information right from the beginning, so it can be overwhelming. So no need to fill in this information right away or have those exact numbers. Additionally, there's another table in relation to treatment-related costs that are not considered medical expenses that may come up for families. So for instance, this can be parking expenses, meals at hospitals, or even lodging facilities that may be out of pocket, so that families can feel a sense of empowerment and plan ahead for these upcoming costs that they may not be aware of. And then there's another table also listed for those household expenses to keep track of. As the cancer community may be aware, while you're going through cancer treatment, the household incoming expenses are still coming through. And so being able to track these household expenses as well, hopefully arms families with knowledge, have some sense of structure to be able to hold onto what all these expenses may look like in the long run. Additionally, within our guidebook, there are insurance coverage options and information on specific laws and acts that are implemented into practice, as well as additional resources. Insurance coverage options such as the Affordable Care Act, Patients' Bill of Rights is listed, and more information on that, as well as employment laws such as the American Disabilities Act, debt collection practices, for example, the Student Loan Deferment Act, and as well as alternative options for, let's say, those populations of people who do not have health insurance. So listing out those alternative options, such as federal insurance programs, such as Medicaid, or to be able to navigate that there are free or reduced cost care through the hospital or health insurance or the marketplace. So being able to have this list of resources and information readily available for those different groups of people is always helpful, and that's within our guidebook. And lastly, just to sum this all up, I think what's really important is to know that with every family, you can't really ever plan for something such as cancer, it's completely unexpected. No one really does plan for cancer. And so I think in just being able to understand that, you don't have to feel embarrassed or ashamed to seek help or ask for help and utilize resources that are available, such as our guidebook. I think so often when we think of cancer diagnosis, um, it may be forgotten that financial distress is very well a common side effect that comes along with cancer diagnosis. And to know that to go at a pace that feels comfortable to you, to remember to be kind to yourself, and also to know that there is a team of professionals and trusted loved ones, such as Anna, your oncologist, or myself, or our other family reach resource navigators, um, nurse navigators, hospital social workers. So we're all here to lend a helping hand and to know that you don't have to do this alone. And thank you so much.